Good morning, my name is Christian Falyar. I'm an assistant professor at Virginia Commonwealth University's Department of Nurse Anesthesia. Today we're going to talk about ultrasound-guided upper extremity blocks. I'd like to start with the supraclavicular block because I think it's a good basic block in that it offers contrast on the ultrasound image and some easily identifiable images. The supraclavicular block is a good option when performing surgical procedures in the upper extremity and hand, excluding the shoulder. We're going to target the trunks and divisions in this block. Prior to starting any ultrasound image, we want to make sure that the patient is in a good position, that they are in line with the ultrasound system, which will allow us to perform the procedure easier with less strain on the body. We're also going to apply sufficient gel to the transducer to make sure that the sound transmission is good. And we're going to make sure that the transducer is oriented to the image. We're going to make sure that the orientation icon is to our left, which lines up to the orientation icon image on the screen, which is also in the left upper hand corner. We're going to take the transducer and holding it like a pencil, we're going to place it in the midclavicular fossa, and we're going to look for a large hypoechoic circle, which should be the subclavian artery. In this image, you can see we have the subclavian artery. In the center, it is pulsating. If there's any question as to whether that is the artery, we can always use color Doppler. By applying color Doppler, you can see we have nice flow through the artery, so we have verified our most identifiable landmark. Using our anatomical knowledge, we know that the trunks and divisions lie lateral to the artery. So we know that the lateral part of this image is to the left, and the medial part of this image is to the right. So we will look for the trunks and divisions as hypoechoic circles just lateral to the artery, and they appear here. Some of the complications of a supraclavicular block include pneumothorax and arterial puncture. One of the ways we can reduce the incidence of pneumothorax is ensuring that the first rib lies over the pleura and inferior to the subclavian artery. The pleura, as you can see, is a fine hyperechoic line with what we call comet tails. You can see the tail streaming down into the pleura, and you can actually see the pleura moving as the patient breathes in and out. By contrast, the first rib, which is just lateral and superior to the pleura, appears as a hyperechoic line. The hyperechoic line is caused by reflection of the bone. However, unlike the pleura, you'll notice there's significant shadowing beneath the bone as the sound cannot penetrate. Once we have the first rib in a position that will reduce the incidence of pneumothorax, we want to check for any aberrant anatomy. It is often possible that branches from the subclavian artery will course through the trunks and divisions. Using color Doppler, we can make sure that our needle path will not be affected by this. So we will apply some color Doppler. We can see the trunks and divisions, and as we rotate slightly, you notice there is a branch of the subclavian artery which actually divides the trunks and divisions of the brachial plexus. At this point, what we would do is we can take off the color, noting our anatomy, and rotate the transducer slightly to find an area that moves away from that anatomy. Again, you can see the aberrant artery there, and again, we move in a slightly caudal position, maintaining the first rib over the pleura, but again, moving away from the artery. And again, we can use Doppler to confirm this. To perform this block, we'll be coming from a lateral to medial position. So the needle will come lateral and it will appear on the left side of the screen, coursing superior to inferior.